Good afternoon, everybody. I'm so excited today. I get to speak with Debbie Witchey. And Debbie and I have known each other for, we'll just say, a long time. Our healthcare paths have crossed, and I'm glad that they certainly have. Debbie, you are now currently president and CEO of the Association for Behavioral Health and Wellness. And if there's one thing we know, and we were chatting briefly, the need just keeps growing ever more. And we're going to talk about some of the challenges and some of the advancements in the space. I do want to remind everybody that on healthdame.com, there will be links to your association, to your background, to resources, and folks could get more information there. But I do want to point out that we knew each other from the time when you were EVP and Chief Operating Officer at the Healthcare Leadership Council here in DC, and you were there for quite some time. And worth mentioning that you spent time in a hospital system, and you also served as a Deputy Assistant Secretary in the U.S. Treasury. So you really come at this position with so much of a breadth of experience among the challenges that people, health plans, providers face in dealing with substance use disorder, mental and behavioral health. Whether we're talking about kids, whether we're talking about the elderly, it's across the board. And I think the best way for us to launch into this is for let me to stop talking and to ask you to share a little bit about the association, what its mission is, who your members are, and we can go from there. And again, I'll probably interrupt along the way. So Debbie, welcome. And let's hear a little bit more about the association that you're running right now. Yeah.
Thanks, Robin. It's so great to be back together with you. I think we were working on health coverage issues pre-ACA
Oh, yes.
previously. So this is, I feel like, the next frontier in the behavioral health space. And our members are health plans that provide mental health and substance use benefits to over 200 million Americans. We also do a lot of collaborative work with other organizations that support the health plan. So we have policy leadership circle partners, we call them corporate partners. That's very much, as you know, my background is trying to get everyone around the table to solve a problem. And so the more that we can do that here at ABHW, the better. But really looking at the coverage for people from that health plan lens. And when I came on board here, which is I guess a little over 18 months ago now, the interest of our members was, okay, we've been working really hard on the access issue. That's still critically important, but access to what? Are we making sure that that's quality access? Are we looking at the fact that people have their brain connected to the rest of their body, and that we really need to be looking at integrated care and coordinated care and things like that? And how do we move behavioral health to that next plane and that next area? And so we're still working on a lot of the issues around access because, as you just said at the beginning, the demand has grown exponentially since the pandemic. I mean, in one way, I think that's a good thing because I think there is less stigma. Not I think. I mean, data shows there's less stigma, not that there still isn't stigma.
People are more willing to be open about seeking treatment, going for counseling, not only sharing that they might have a quote unquote mental illness or, a substance use disorder challenge or someone in their family does, but people are, I think, much more, not everybody for sure, but a greater percentage of people are willing to talk about it. And, that's always the first step to really trying to get the help people need. The other is, as you say, access. And that's still a real stumbling block. Before we move on from your members, I do want to give you a chance. Health plans, I know they get a bad rap from time to time, and I know that your members are concerned about some misconceptions and so on. So help us understand those misconceptions and how how they are stepping up.
I think that in general, there is and I hear it all the time. I mean, actually on the physical health side too. And I've experienced it where my health insurance carrier will be blamed for something that turns out is not, that that the provider's office hasn't even filed the paperwork yet, so the plan can't really be approving something if they haven't been asked yet. Putting that aside, I think, some of the misconception is that health plans are always trying to limit care, keep care from happening, deny care. And, if you think logically about it, that just doesn't make sense because what ends up happening if you're denying care or you're not giving the best care to help someone to avoid ending up in the ER or inpatient is the health plan has to cover that much more expensive care. And I think about it particularly recently in the substance use area. And unfortunately, I've had several friends just in the
Mhm.
last year contacting me because they wanted to send their child or needed to send their child to a substance use treatment program, had selected what they wanted based on word of mouth, called me to say my health insurance company won't pay for it, ended up draining their child's college savings and to pay for it out of pocket, and then
Oh,
ended
wow.
up with the child back having a relapse almost, pretty quickly. And I was able to work through, luckily, one of our members provided their health insurance. And so we were able to help get the child into a program that was covered by their health insurance. And, it turned out that was a much better program that had outcomes measures, that had data. And so, in that case, there's a reason the health plan wasn't covering the other treatment. And that certainly is a challenge of making sure that we're really providing any kind of treatment or program that's helping people to either stabilize, get better, stay out of the ER, stay out of an inpatient environment, if at all possible, that kind.
How do families get that kind of information about the quality level of a treatment program to know whether where they think they're sending someone other than word of mouth? Do they go to the plans and ask for that? Who do they go to where
Yeah.
it's unbiased information?
I think, I think that in a lot of cases the plans can provide that information. I've found, again, I have not done any research on this. I probably should, but anecdotally, I have found that people do not think to turn to the health plan to try to find a provider in network or to try to find a program or a treatment program in particular, to get more information. And oftentimes, that's why every health plan has a chief medical officer, has, someone in the case of our members who are the chief medical officer for behavioral health specifically, and they work with these programs day in and day out. They know them all, and I'm amazed how many of them give out their phone number and their email on a regular basis to people because I've been traveling with a lot of them doing speeches and trying to increase awareness
Yeah.
around the country, and so I've been with them a lot, and that's what they feel like it's their obligation to help people find good care, and they're willing to help.
Wow. Okay. Well, that I learned something because I didn't know that you could go to a health plan for that. I always think of sort of third party organizations that collect, evidence-based information that people can go to because when you are in a crisis and when you have a family member who is, really struggling, you want to move quickly, but you want to move smart. And it's a crisis, so you're not always thinking clearly and you just want to fix the problem.
And
So,
there are some of those, I would definitely say that behavioral health is and this is one of the things we're trying to work on, is behind physical health in having as many of those third party resources or even in having data and
mhm,
information all the time, quality metrics that were started 20, 30 years
sure.
ago on the physical health side. But there are some of those organizations, and I can send you some of those if you want to
Yeah, we can
post
put the
them.
links up if that's helpful
Yeah,
for
that aren't
different
related to
purposes.
us, but,
Yeah.
might be. But that's also part of what we're really working on is trying to develop more quality metrics that are agreed upon quality metrics in some of these treatment areas. And, I think one example is around autism treatment and
Oh, say a little more about that because that's so top
in
of,
the
yeah, it's enormous.
Yeah. And so, that's an example when ABA first became a treatment for autism, we didn't have a lot of data. We didn't really know what worked, what didn't work. In all honesty, families were desperate and they needed help. And so we started to see legislation passing in different states around the country that really required coverage no matter what, and plans were paying for it. And then what we started to see was that there was this exponential growth, something like in some cases up to 400 growth in a year in ABA billings. At the same
What
time,
age? Yeah.
applied behavioral analysis. So it's
Okay.
a certain type of treatment for autism,
Okay. Okay.
which can really help improve functionality and can help, it plugs the whole family into the
Hmm.
treatment, and it's a valuable service. But what we began to see was it was only valuable within certain parameters. So you did need to have an environment where the family could engage. When you got above, and again, this is general, this is not across the board,
Sure.
but in general, getting 40 hours a week of ABA was probably had diminishing returns after a certain point, depending on the person and the treatment. What we started to see was, particularly in Medicaid programs, the states, not the health plans, started cutting back on what they would pay for. And instead of doing it based on what was clinically appropriate, which is what the health plans wanted to do, some of the states started saying, we're not paying for more than 25 hours a week, for example. And again, that in general, that might have been fine. But two things with that. One is it wasn't always the right treatment. It was not based on clinical need. It was based on budget. And secondly, it just sort of raises the bar or changes the bar. So everybody's going to end up getting 25 hours, whether they need 25 or 40 or 10. And so we brought our members together to start talking about, okay, what do we think is
Right.
clinically appropriate? What are the guidelines that we need, and based upon quality outcomes and not on cost? And so we developed those and put those out, a couple months ago. And we know at the federal level, CMS is looking at this now, and we've shared our thoughts with them. No, but the other thing that we were seeing was that because ABA was so prevalent, it was kind of the only game in town, it was potentially precluding innovation of other kinds of treatment. And we all, it's not like ABA is the panacea and going to solve
Right.
everything.
Right.
So that was the other thing, is we really wanted to encourage some of these other promising treatments to be able to get out there so we could learn more about them. So that's an example.
There are treatments that your members are, because there's a lot of innovation happening all over the place. So, are there some promising treatments over the horizon that people should be getting excited about now that you?
So we're just starting. I think we're sort of trying to figure out what it's going to be, whether a paper or maybe it'll be a blog post. I'm not sure, but talking about some of these other
Oh,
opportunities.
okay.
So it's not out yet, but it's something that we do have in the works, because there are some of these opportunities. And for example, HealthWorks, which is the venture capital arm of Care First. I
Okay.
mean, they're a separate entity, but they've been investing in some innovative treatments in this area to try to see what we can advance.
Behavioral health generally, or in autism
Autism
specifically?
specifically.
Autism
To
for
ABA.
children, or is it across the board, like ages across age, or maybe you're not sure?
I'm not sure.
Yeah.
I'm not sure, so I don't want to say, but I do
Yeah.
know that they're investing in some of these companies, so that's nice to see.
That's really interesting. I didn't realize there was that much going on the plan side. So that's now I'm learning a lot today. My God. And
We want to try to take on some other areas where, there certainly has been a lot of, I guess, discussion. For example, residential treatment centers, and we just saw the facility where Paris Hilton was for a
okay.
period of time shut down last week or the week before. And that's another area where there really are not a lot of good quality metrics. And if we could contribute to helping develop metrics in that area, I think it would really go a long way. So we're gonna tackle that next.
Yeah, and it could not be more timely, because not only are the quality metrics, they need to up their game, but the number of facilities, there's just not enough help out there. So, can you speak to that? But tied to that is the question of all the workforce complexities. And I know you guys are looking at that. What do we need to know about those workforce issues that are facing sort of the other side of that? We need help, but where is the pipeline and what type of pipelines are we talking about?
Yeah, I mean, that is probably the mo I think you asked me in a pre-call or something about what do I get discouraged about, and this
Yeah.
might be the area because
Okay.
it's so complicated, and there are, I think so often not just providers, not just health plans, everybody sort of wants to just find the panacea that, and there is not, I don't think, one solution to this. I mean, part of the problem we were talking about earlier is that we're seeing this exponential demand that didn't exist. So every time health plans get more people in their networks and get things set up, it's never enough. So we've really got to look at a lot of different fronts. I mean, one is how do we get more people into the field? How do we need to look more broadly at who can provide these services. It's not, a lot of these services are being provided by primary care, and I don't think that's ever going to change. So let's make sure they have the tools they need to, obviously in some cases people have serious mental illness and they need to be referred to a specialist, just
Experts,
like you
yeah.
do on the physical health side. But sometimes, that's not the case. And with the right tools, the primary care physician or nurse practitioner or others can be providing it. I also mentioned this earlier, the brain is attached to the rest of the body, so we need to be
Exactly.
thinking more about integrated care and how that works and how that fits together. And I've talked about this publicly before, but I went through a breast cancer journey. Everything's fine for me now, but that is a field where they've done a really good job of integrating all the pieces together, and the
Right.
health plans have done a really good job. So they know when I have a certain diagnosis and I have a certain score and a certain type of tumor, that this is the treatment plan I'm going to need. They go in and they do all the pre-auths for
Mhm.
that whole process. So when it comes time that I'm going to need those next pieces, it's already set up. It includes nutrition. It includes behavioral health. So I can call anytime I want for the 5 years that I'm being monitored and get those services anytime I
Wow.
need
Wow.
it. But we need to do a better job of figuring out how to integrate these kinds of
Well,
treatments
for
together.
sure, that's always been a challenge that we separate out behavioral mental health from health. And there's absolutely no way you fill in the blank, cancer, and the list goes on. I mean, they all go together and they're very different needs. You can have very severe psychotic conditions. Schizophrenia is particularly challenging so many, and then there could be other behavioral health issues, and the needs and the expertise are so
So
different.
different.
The types of treatment and therapy available. The other challenge that comes to mind, in a very early interview, I interviewed Nora Super and her husband, Dr. Len Nichols. And Nora's been very public, has written in Health Affairs and other places about her experience living with very severe major depression and suicide, multiple
Right.
suicide attempts. And Len, as her beloved spouse and helper through this, is told upon discharge that keep an eye on her because odds are the next 48 hours are the most crucial. But there's no discharge planning. Why? Because liability laws differ state to state, and the facilities are caught between a rock and a hard place when it comes to what they can and cannot do from a legal standpoint. So you're leaving a loved one with someone who's just been through such a trauma to come home, and now all the responsibility is on somebody who's not
On
necessarily trained in
Right.
this
Has
field. And it's this, once again, patchwork of different laws and liability concerns, and that has to feed back to the workforce challenges.
exactly.
Because you can have a pipeline full of people, but if the system,
Doesn't allow them to, yeah. And
then
that's
then the families are stuck in this horrible.
Limbo, yeah. And that's so yeah, having care teams and some of these collaborative care models are developing, but we need to improve the economic incentives to really make those work. Licensing is another issue. One of our members, Kaiser, is actually doing a lot of work in this area because you see so many therapists who graduate but never actually get licensed because of all of these barriers to actually, that come from supervision and other things that make it really hard to then take that step to get your license. So, what can we do to prove that so that people are actually
And that's a state issue, right? It's a state
mhm.
licensure issue, so
It
some
is, and
states are easier than others, I imagine.
correct. And some, just, I think some states licensure boards intentionally make it
Sure,
difficult, and
sure.
some don't. And then, we've already talked about other things like, being able, making sure that people are making progress. The days of going every week for the rest of your life to your therapist and maybe making progress, maybe not, that's really not necessarily the best for the patient or for anyone else who's in the pipeline. So how do we address that kind of thing? And then of course technology is another piece. I think, we definitely saw during the pandemic that for behavioral health uniquely maybe in some cases, telehealth is actually a better modality. People are more comfortable in some cases, at least in the beginning, seeking treatment through behavioral health. They're more willing to keep their appointments and things like that. Not to mention that it certainly helps for rural communities, underserved communities where people don't, have transportation issues. It can help them get.
Isn't it? Because oftentimes, as we said, with the integrated nature of behavioral health, there are other physical limitations people have, and travel just can be really, even today where it feels like 110 degrees out, who wants to go
Yeah.
outside?
And so you feel like, oh, I don't feel like it. And so you just
Where
don't
it's
show
not
up.
healthy to be out in it. And if you could do it over the computer, you do need to be face to face from time to time, 100%. But when
Mhm.
you can supplement with something that makes so much more sense, like why wouldn't you do it? And yes, I know connectivity is hard in some communities, but there are innovations that are happening and programs that can provide. And where it isn't, those are still challenges we need to figure
Need to
out
work
for
on, but
sure.
it's one more
Yeah.
option, one more
Yeah.
modality, so we just need to have a lot of these different options to fit different circumstances.
Is there one thing that gives you the most hope? And I know we're getting close to time here, so I'd like to end on a positive note because with the demand and with it being hard to find services, I know you've mentioned technology and innovation is really promising out there. I imagine AI to some extent could be helpful in
Mhm.
specific applications as long as there are protected guardrails. And I know privacy and confidentiality continues to be
Yeah.
utmost of a concern.
Yeah, I mean, I do think that AI can serve a really important role. I mean, we're actually seeing that it can help people to advance more quickly with their treatment. So if they go in and see therapists and then their therapist gives them homework in essence using AI or those kinds of tools,
Interesting.
then they're more willing to pick it up and do it and then come into the next visit. So yeah, I mean, there's just all sorts of different treatments. I mean, I think overall, we already talked about it a little bit. I think what I'm probably most optimistic about is this dramatic decrease in stigma. And
Yeah,
again, it's not gone. We still are dealing with a lot of different issues, but I looked it up this morning because I didn't want to say the wrong statistic
I
when I
appreciate
talked to
that.
you. I'm like, what's the latest?
Yeah, yeah.
And I mean, people who are willing to tell friends or talk to doctors or ask for treatment, I mean, they're all over 80% now that people say they would be willing to do it. Now, I'm not sure when push comes to shove that it's over 80%, but at least people are saying that. Like they know that they should be okay with it, even if they're not okay with it. And that's huge progress as opposed to I mean, just in my lifetime, suck it up, stiff upper lip.
Oh, absolutely. Absolutely. Well, as I always do, Debbie, I end every interview with asking for a favorite song or a song that best communicates what you're working on. And so if you don't have an answer for me, you can always email me later. But if you had a chance to give it some thought and want to share it now so we can add it to the playlist, I'd love to.
Well, I know you always do this, and so I love Kenny Chesney so much.
Ah,
He always so I really wanted to pick a Kenny Chesney song, which there are, there's Get Along, there are others, but I would say, from The Greatest Showman, A Million Dreams. That's my pick
oh, okay. Let me write it
because
down.
it's positive, it's about the art of the possible,
I love that.
and I love that. Yeah, so
Yeah, there
that's
you
my
go.
pick.
Ending on a high note, even better. A million dreams. Oh, that's wonderful. I mean, I really did learn a lot today. And I know that it's a tough position. Your association is dealing with a lot of issues. I think, health plans play such an important role in the whole system. There have been times when people are really frustrated, myself included, but we understand the role that they play. And I think the more we can all have these conversations, figure out where things are not working, how can we all pull together to really call it, make the changes that need to happen. The field is doing so much to push forward. I think some of the ideas that you've brought with the different advisory circles and corporate and other partnerships, to me the whole way you get to goal is with partnerships, and sometimes they're the unlikely and sometimes they're the ones we used to call it the messy middle, where you bring people that maybe just did not see eye to eye in the past at all, and you have to sit down and you have to work through it. And it isn't easy and it's really hard. But at the end of the day, people are suffering and we have ways to help. We may not be able to make it completely better, but we can make it much better for people than it is. And shame on us if we can't all sit down and work together. So
We
I
have to try.
we have to keep
Totally agree.
fighting the good fight because it really does matter to people. So kudos to you for these great ideas and all that you're bringing to the association. And we'll make sure to put any resources up there that you think are
We'll send
important.
some over, yeah, because
Yeah,
whatever we can do to be helpful, and people
fantastic.
reach out, and I answer questions and complaints all the time, so I want to hear. I
Okay.
I can't we can't get it fixed if nobody speaks up.
Exactly. That's right. So again, thank you very much for the work that you're doing and for taking time to speak with me. And I wouldn't be surprised if I swing back and ask for a round two because I have a lot more questions, but I want to be respectful of your time. So
Oh, you're
again,
great.
thank you so much. It's great to reconnect, and I'm
Thank
sure I'll be
you.
in touch very soon.
Thanks a
Thanks a
million,
lot.
Robin.
You bet.
Care.
Have a great day now. Bye bye.
Bye.